Hi, my name is John Hilvert, and I am a physical therapist at Baxter Regional Medical Center. I've been a therapist now for 26 years and have been in this community for about 15 years now. Guess I am here today to share my viewpoint on why I think the new proposal for a recreational facility here in Mountain Home is a good one. And really my motivation for sharing is twofold. First, as a therapist and as just a person who is interested in improving my health, I have seen the tremendous health benefits of exercise, not only just physical health, but I've also seen both of my patients and myself how that can be a vehicle toward improving your mental, spiritual, and social and emotional health. I've seen this time and time again, and I think it's a really important thing as we consider the benefits. Secondly, as I have come to understand this proposal a little bit better, I've also had patients approach me and they have wanted me to share not only my experience, but also my experience with working with them as patients and how they have benefited and how potentially they could benefit from such a facility. So really what it comes down to me, there's 5 main reasons why I think this would be a really good thing for us. The first is that I think it appeals to all different age groups. So when you think about having something like a splash pad, a water park, a pickleball area, an exercise facility that has weight equipment and cardio equipment, a walking track, a therapy pool, all these things appeal to a wide variety in age group, all the way from newborns all the way to advanced age groups. So that has a definite appeal. Secondly, I think this would not only improve people's physical health, but as stated previously, I think this would really serve to improve people's mental, spiritual, emotional health. I have an example of this. I had a patient recently who I was working with, and she had shared her concern about her husband. And when I asked a little bit further about that, she said that her husband was a veteran and that he was suffering from post-traumatic stress syndrome and depression. I encouraged her to get a physician referral and to get him into therapy with us, and she obliged, and we did see him. To make a long story short, after about 3 or 4 weeks of therapy, I was asking the patient how he was progressing, and he described to me that he felt like a fog was being lifted from his head, and he felt the best he had in a long, long time. Put a long story short, he actually really did well, and it was a catalyst for him to achieve a much higher level of health than he was doing and a much higher level of function that he was enjoying prior to coming to therapy. In addition to that, I was part of a focus group at Baxter, which got together to discuss different ways we could be helping our community with different aspects of health. One of those areas was mental health, and one of the issues we have in Arkansas and in Baxter County is high suicide and mental health issues in general. As stated previously, the benefits of exercise, especially as it relates to mental health, is well known and well documented. And I feel like a facility like this would take us a step further in terms of addressing those needs in Baxter County. Third, it would also facilitate improvement in the quality and potentially the quantity of our retirees' lives. One of the things I take great joy in doing as a therapist is trying to keep people home and independent as long as possible. That's what we talk about, is trying to facilitate their independence. I work with people a lot who have issues with balance, and when they have a fall in their past, or if they have difficulty getting out of a chair, it's usually a good indicator that they are going to have a future fall. Patients will describe to me once they've had a fall And if they've had repeated falls, that they have an anxiety toward walking, anxiety toward another fall, and this really sets up the table for another fall in the future. This can lead to just general disuse atrophy or lack of getting up and moving around, which really starts to send the patient in a downward spiral of health. So I think a facility like this would be able to help encourage patients to join a facility to help improve their health. Fourth, it would provide a continuum of care for those with joint deterioration, both hips, spines, knees, shoulders, etc., and for those who need a safe place to exercise. So for example, for those with joint deterioration, an aquatic environment is perfect for these folks. So many times, and what comes to mind is an example of a patient who had come to me in a wheelchair and had not been walking for several years. After about 2 months of aquatic therapy, the patient was able to get up and move around and walk in his home. And the issue we had primarily was once he left therapy, there are limited facilities for him to be able to go and to continue on. A facility like this will provide an avenue and an environment for him to continue on. In addition to that, there have, many people here enjoy the lakes and the trails that we have to offer. Some people, because of their balance issues and because of their intolerance to extreme temperatures, cold, heat, cannot be outside and enjoy those nice things that we can enjoy. A place like this would offer a climate-controlled atmosphere for them to come in and continue to exercise and continue their progress and progress to even higher levels of function than they were able to achieve before. Lastly, I realize after being to several of these meetings that there are financial issues and they need to be addressed as to how we would support this and how we would raise the money for this. It definitely needs to be addressed, and I know there's several sides to this. I guess what I would say is ultimately we all pay for health care one way or another. We'll either pay for it to prevent or to limit our risk of getting disease, injury, that type of thing, or we'll pay for it on the backside, and we'll pay for it through the treatment of those things. The old adage of an ounce of prevention equals a pound of cure, to me, rings true here. We know as healthcare professionals that if we're treating a patient with a lot of comorbidities or things that are in addition to the primary reason that they're coming in, that we're going to have a much more difficult time treating that person. It's going to take a little bit more of an effort. In addition, if someone's recovering from a fall or an injury or a surgery, if that person has a lot of things in addition to that primary reason they are coming, it's going to take them much longer to recover from that injury or surgery. So in terms of that, it really does pay to have a population who is in general in good health. My last point on that is that it was interesting. I was listening to a conversation with the director of the CDC before he stepped down, and the reporter had asked him a question about why the United States had been hit so hard and with the amount of COVID cases and deaths. And he had an interesting response. I think the reporter was looking for a political response, and instead the director said that he felt that due to the high level of comorbidities that we have in the United States, the general poor health and multiple things that are wrong with us, that he felt like COVID really targets people with comorbidities. So again, when we think about, we bring this back to Mountain Home, what this has to do with us, a facility like this, in my opinion, would help to facilitate people's health in many different ways and hopefully reduce our risk and our comorbidities so that if something does happen, as it will with all of us, that those things will be minimized and that it can be better treated, and that the road to recovery will be a whole lot quicker than if we're without such a facility. So in summary, I would just share that my belief that the proposal to build a multi-purpose facility in Mountain Home, in addition to the enhancements of our parks, would be a significant thing and a helpful thing for our community, and possibly even lead to economic growth as well. Thank you.